This video is the one I promised that I was going to give an experience in thoracic surgery with hemorrhage. But first I want to give you 3 takeaways. You may get more, but at least I want you to have 3 takeaways that you can add to your knowledge base in dealing with thoracic surgery, and specifically the pulmonary artery in this situation. So the first one I want you to take away is that things can go from cool and calm and collected and running smoothly to all of a sudden critical and crisis management and life-threatening. I remember when I first started doing laparoscopic thoracic surgery and open thoracic surgery with a surgeon, we'd been working for a couple hours, and I asked him if he wanted someone to call the family and tell them that things were going well, and his answer was no. At the time, I didn't understand it, but as I did more of the thoracic surgeries, I realized that things can go along just great, and then 1 second, and then the next second you are in a life-threatening situation because you have a lot of large vessels and they're buried in lung tissue and they're difficult to see, and if they do start bleeding, they're going to bleed quickly. So later on I did understand. The number 2 takeaway that I want you to take from this is that if there is bleeding that you have from a large artery in the chest, you want to suction below the level of bleeding. So I had heard about one of the surgeons who had run into a pulmonary bleed, and I had never been in one before. So when I caught him in the hall, I asked him, what would I as the assistant do if we got into that sort of situation? And his response was to suction below the level, the blood that's below the level of where the bleed is. And that makes sense because the patient's already hemorrhaging. And if you are sucking at the tear or the hole in the artery, then you're going to be speeding it along and exsanguinating the patient. So if you suck the blood that's already leaked out and it's below, you're not going to be adding to the hemorrhage. And then the third and final takeaway, when you were speaking about the pulmonary artery, remember I mentioned in the last video that that's like butter, and it's very fragile and very thin-walled and no smooth muscle, hardly any smooth muscle. So you want to be on a very, very light touch with this. So I'm going to demonstrate that with a story. So the surgeon and I were doing a lobectomy. I was assisting on it, and he's a very experienced surgeon with very good hands and gentle hands. And it was revision. So anytime you have a revision surgery, it's more difficult. And usually you have scar tissue to deal with, and the scar tissue is not as flexible and forgiving as normal tissue, and the anatomy is also distorted by the scar tissue. So we were doing a lobectomy revision on a patient who probably had a wedge before. And so the doctor had done all the dissection of the lung. Now he was ready for the bronchus. And as he went across the bronchus for the last final stapling that he was going to do to remove the lobe, as he went under the scar tissue and across the bronchus, the stapler tore a hole in the pulmonary artery, and it started to bleed. And the pulmonary artery is rather large. It can be as large as my finger or slightly smaller, but it's a large vessel, and it was bleeding very quickly. So knowing what the doctor had told me to do, the other surgeon had told me to do, I started sucking below the level. And he yelled, don't suck, because he was concerned. I know that he was concerned that I was going to suction at the hole and that I was going to further add to the hemorrhage. So I stopped and I stood there waiting for him to do what he needed to do. And he was putting his forceps in. He had his DeBakey's. He was trying to put it in the hole and twist to purse string it closed. And he did that 2 or maybe 3 times, and it wasn't working. And my mind says, I can't just stand here and do nothing. So I just slid my finger down, say this is the artery. I just slid my finger down really quickly. And if I could tell you, again, it was that butterfly-like touch on the perforation in the pulmonary artery. And that was all it took to stop the bleeding. And so we had now gone from a life-threatening emergency to a controlled environment that we could deal with the problem. So at that point, things calmed down, and he would ask me to pull my finger back a little bit to see what was going on. And then as he got the utensils and the suture that he needed to repair it, and so I would just, as he told me, withdraw my finger bit by bit as he sutured up. And so we were able to address that and stop the hemorrhage and have a successful surgery with the patient. And afterwards, when he was discussing it with me, he told me that he had been in cases before where he had seen, at least one, where he had seen a resident put his finger through the pulmonary artery and punch a bigger hole and really end up in major problems. So I'm sure that's why he reacted the way he did. And so I'm telling you this so that if you get in this situation, what the doctor told me helped, and now maybe it can help you if you ever get in this situation too. So I hope this helps.